Good morning and welcome back. Well, May is Stroke Awareness Month, and this morning from Gunderson Health System, Dr. Sunil Mutgi joins us to talk about recognizing the signs of a stroke. Dr. Mutgi, thank you for waking up with us this morning.
Hi, it's good to be here.
We're glad to have you. So this is something we've seen the FAST sort of.
Yeah, Be Fast, the billboards.
Yeah, the billboards out there. What does Be Fast stand for?
So it's really a simple way to remember the main symptoms of stroke. B stands for balance, so acute balance changes. E is for eyes, so if there's any changes in vision. F stands for face. A stands for arms, any weakness in your arms. S stands for speech, if you have any speech changes. And T actually stands for two things. One, which most people know about, is time, but it's also being changed to make awareness of another type of stroke, which is a stroke with a bleed. And it now stands for also terrible sudden headache. So when you put those symptoms together, if you have any of those symptoms, they're signs that could potentially mean a stroke, which is something that means you should get to the hospital as soon as possible.
Right. Yeah, those signs definitely something to call 911 right away. What are the likelihoods of someone coming back from a stroke?
So much better nowadays. We have something called interventional therapy, which is an actual procedure where we remove clots in patients that come in up to 24 hours. We have almost 1 in 3 patients we can get almost back to normal, which is a really good response rate.
Oh, that's fantastic. Going back to the acronym, Be Fast is really what it stands for, because it is all about time when it comes to a stroke. How important is it to stress that when you recognize these signs to get help right away?
So the sooner you get into the hospital, I know as I just said, we've expanded our window to 24 hours, but the sooner you get to us, the better your outcome is, the more likely we can get you back home and get you to a more normal function.
So are there some risk factors involved that may show that you might have a stroke in the near future?
So some of the things that we work on regularly, hypertension is the big one, but there's also diabetes, there's smoking, and if you have any other type of what we call vascular disease, then that puts you at risk for a stroke as well. And you should work with your primary care physician to try and get your risk factors under control.
All right, things to be aware of during this Stroke Awareness Month. Dr. Mutgi, we thank you for joining us this morning. It is now 9 minutes.